My name's Donna Davenport. I'm a district nurse facilitator in Stockport and cover 8 district nurse teams, a range of community staff and the evening nursing service as well. I am also a professional nurse advocate and a mental health first aider within the organisation, which I really enjoy, and I'm a Queen's nurse as well, which I'm very proud of. I've been a PNA since 2021. I was one of the first community nurses to do that training with the University of Central Lancashire. It was during the pandemic, so it was all online, but it was great to kind of connect with lots of different professionals across the country, really, who were all doing it at the same time. I wanted to do it because I felt the role really reflected and enhanced the work that I was doing in supporting the health and wellbeing of staff within the community that I already provided, both on a one-to-one basis and also group supervision across all community staff, so bands 3 to 8. So I was already very involved in supporting staff with supervision and their health and wellbeing, really, and I saw it as a real opportunity. And of course, there's an abundance of evidence to show that improved staff health and wellbeing is linked to improved patient outcomes, and I see that every day in my practice. The training equips you with the skills, knowledge and behaviour to listen to and understand the demands placed upon staff. And of course, we saw that hugely exacerbated during the pandemic. But what we know now is that staff were struggling before the pandemic. The pandemic just exacerbated that and made things much, much worse and much more difficult for staff on the front line. So as a PNA, you're able to support staff, help them to identify solutions and empower them in their practice to contribute to the quality improvement agenda, rather than feeling that they're struggling along and that there's kind of no way to improve things. PNA role very much focuses on the A-Equip model as a means of support, which has 4 elements of different aspects of support, but the focus is very much on restorative supervision. So I support staff in my PNA role through supportive restorative supervision, which is a key function of the A-Equip model. And again, that's very much solution focused and recognises the impact of complex work health professionals do every single day. Within my role as an educator, I'm also able to support the education and continuing professional development of staff within the formative aspect of the A-Equip model. And the pandemic, as I've mentioned, really highlighted the demands placed upon staff in the community. Prior to that, it very much focused on critical care. And in the community, staff are dealing every day with complex chronic disease management and end-of-life care. Early intervention and supported mentoring helps avoid hospital admissions, as staff are often expected to make complex decisions which impact on that in very difficult circumstances in the community under immense pressures and constraints. And even the most experienced member of staff can have difficulties and experience stress and burnout. So it's essential that they're supported to have a safe, reflective space to be able to talk about some of those things. I also work closely with our health and wellbeing service to signpost staff to relevant agencies and support. And I support trainee PNAs who are currently doing the training as a mentor, which I really enjoy. I've got 3 years experience behind me now, so I can really support them in the role, which for some staff is actually very new. I'm quite fortunate in my role as a district nurse facilitator that it's very much a key part of my role anyway. However, alongside mental health first aid and the professional nurse advocate role, that still places heavy demands. So it's important that your organisation supports that from the top down. Raising awareness of the role when something is so new has been challenging, but I've worked with other colleagues across the whole organisation, so in the acute setting as well, who are PNAs, and we now have a regular monthly forum We felt that was really important for us as PNAs because we were obviously taking on some of the stress and anxiety that staff were feeling. And so it was important that we had a safe space as well to come together and talk about some of those challenges and get support for ourselves. So the forum's really crucial in that, and that was implemented with the support of our deputy chief nurse, who again is kind of really encouraging and supportive of the role. I've used every opportunity to showcase our work through the Trust events and conferences. So wherever your organisation has conferences or roadshows or workshops, you know, we've used that opportunity to have a stand, and we've got our posters, we've got leaflets, and we've got lots of information, obviously, from Health Education England that we can use to support some of those discussions. And that's been really well received. So I find the role immensely rewarding. It's something that I'm passionate about and have been throughout my career. And this role really gives you that kind of emphasis really to support around supporting staff health and wellbeing. Staff feedback that they really value the role, both personally and professionally. I've had staff who've said, you know, thank you so much. It was a lifesaver to have that reflective time. So I personally value the time I'm able to give staff and feel they've been able to look after themselves and speak up when things are difficult rather than waiting for it to reach crisis point. The role gives me a great insight into the real issues that staff are facing. So I'm also able to signpost them and encourage a solution-focused approach, whilst also being able to advocate on their behalf where appropriate. And obviously that involves maintaining confidentiality, but there might be key themes that you come across as a PNA that you can then share at a higher level to say, you know, these are some of the issues that staff are talking about and that we can then build on and work towards overcoming in the future. So I'd encourage anyone who is passionate about looking after staff health and wellbeing and is skilled in reflective practice to train to be a PNA. It's a real skill to have under your belt, and it kind of gives, as I mentioned earlier, that kudos to you providing reflection and support for staff. Make sure your organisation and key stakeholders are on board and will support you to deliver it once you've trained. As I mentioned, it's resource intensive and it can't be just something that you do on an ad hoc basis or just on top of your day job. It needs to be supported with resources and time. Read around the subject and talk to current professional nurse advocates in your organisation about what they do so that you can build on those important networks. And you know, having those networks, having the support of other PNAs is really important. Start to provide supervision as soon as possible after completing the course so that you can start to build your confidence and skills and consolidate what you've learned, avoiding that age-old theory practice gap. The sooner you start to do it, the sooner you become confident and skilled in that practice. And finally, seek support for yourself whilst acting as a PNA and ensure that you have regular restorative supervision too. That's really important for you when you're supporting other staff and obviously contributes towards your mental health and wellbeing as well.